Cheers.
Cheers, buddy. How you doing?
I'm good. Hey guys. Thanks for joining us. And like Steve said, man, we're supposed to get
Well, they're talking all kinds of
they're
crazy
on
numbers.
but like 18 to 23 inches, possibly. It started last night. We've got maybe 3 so far, I'd say.
Wind is blowing. I think that's going to be the biggest thing. We were just talking about that before we cut on the air.
Yeah.
I think the wind is going to be the biggest hazard that we're going to have.
Yeah. Anyway, but we're here, right?
We are here.
We're here.
We're answering phones, and we got webinar scheduled. And John, just a little bit of a background on this. We've got probably a nice little mix of Medicare brokers that have been dedicated to the Medicare supplement world.
You bet.
That see this growing Medicare Advantage business, and they're saying, you know what, I need to find out more about it.
You bet.
Now, for years, a lot of brokers out there did sell against the MA, and they're not
Right.
wrong by doing that. They're
No.
not wrong.
No, but it's like the old line, if you can't whip them, join them. And that's the Med Advantage is for sure here to stay and growing in popularity and numbers and all of that. So we're just welcome. If that kind of fits you, or even if it doesn't, this is kind of like a 101,
Yes.
basic that Steve's going to walk you through here, but we want to walk with you. So
Sure.
if you're new, we want the experienced guys, and we try our best to get those, but we would sure love to grow with you. If you haven't written your first MA yet, but you want to learn it, get into it, we hope you decide to walk along with us.
Exactly.
We'll walk together. Huh?
Exactly correct.
Yeah.
Exactly correct. Jason, if you could go on to the next slide for us, please. Just some of the dynamics that happen, John, is that there are annual certifications that we're going to talk a lot about what is known as the AHIP. Maybe you've heard about it, maybe you haven't, but the AHIP is an annual exam.
Yeah.
And the first time or two that you take it, it can be a little bit of a bear, and it can be a little bit intimidating. It certainly can.
Right.
But I can tell you that the farther you get along with your career in the MA business, I've got guys that have been in the business for 10 years, and they knock that thing out on day one in 2 hours.
Right.
They're done with it,
Right.
and they're moving on to the next one.
Yeah.
It actually is a test that we have to pass every year. Typically what happens, John, is they open up. For example, this year in June, about 5 months away from now, in June, they're going to open up the AHIP exam for 2023.
Right.
The reason is, obviously, we have a selling season in October 15th to December 7th. And so we have to prepare for that, because we're going to be talking about product for the following year.
Right.
So that every June is when the product itself, the AHIP test, goes live for the following year. That's the one we have to pass. If by chance this is your first year and you're thinking about getting into it, you can actually take that exam in June, pass it, and you will be compliant to sell product for the remainder of 2022, plus all of 2023. So unless we get a specific ask from a broker that says, I want to sell it right now, we may just step back a little bit, make sure we understand the groundwork, get ourselves AHIP certified in June, and just begin the whole process.
Because if they wanted to write one in April, they're going to have to get certified for 2022, then turn around and take it again in June.
Absolutely.
Got it.
And so, and it's not that I don't think it's worthwhile, but again, it's a lot of trouble to go through.
Worth talking
It's
through.
worth talking through.
Yeah.
The cost is $175. If you want to go directly to AHIP and pay that amount of money, you can do that. The first time I did it several years ago, that's exactly what I did. Today, what you find are carriers that if you sign up through their portals, that you can get typically about a $50 discount from that, or the cost of doing it is $125 to you as the writer.
Good.
And then the insurance company picks up the other
Okay.
$50. Give us a phone call. We've got links that we can send you where you can sign up and get those $50 discounts as well.
Yeah.
The AHIP covers Medicare Advantage, as well as prescription drug plan explanations, marketing and compliance guidelines, and laws on fraud in Medicare. The AHIP itself is broken down into 5 modules. Not that it's on this webinar, but what we would encourage you to do is you're allowed to sit there and make a copy. You can print the module quizzes at the end of all 5 of those modules And that's a great study tool. And in fact, you'll find a lot of the final tests coming from the modules themselves. So we encourage you to print those, take them, pass them, come to understand them, and it's simply going to make that final exam a lot easier. So just a little bit of a,
Yeah,
just a little
little
bit of a
tip.
guide, little tip,
All
little
right.
tip. Here's the web page. Everybody's going to get a copy of this that's signed up here today. So you'll get this link if you want to go there and just kind of browse around or take a look and register for the AHIP for the first time. You can do it right here at this particular spot. So pretty fundamental. There's also, John, carrier certification.
So you got to do the AHIP. It's the big one for everybody. Then individual certifications for carriers.
Yeah, there's a bunch of carriers out there, and our philosophy here has been, as we've watched this over the last 5 years or so, is that we don't want to throw too many carriers at these. We can identify 2 or 3 players that are going to be in your region, and we're going to say, get used to this product. You're going to be selling a lot of this, and we're going to go to a little tool that we have access to show you how we can come to these conclusions. But we're not going to overload you. And as your experience becomes better and your confidence becomes better in the MA space, you know, that's when you can take on having more than 2, 3, or no more than 4.
It's kind of like med stuff. I mean, really, you know, you might, there's 30 of them in your state, but you're not going to write with all 30. You're not going to appoint with all 30. And you'll have your 1 or 2 favorites.
We're going to apply the common sense rule.
Yeah.
You know, that's just exactly what we do. So,
Like it.
yeah,
Like it.
Yeah. In addition to, obviously, in addition to the AHIP, you must certify with each one of your MA carriers. And again, it's on an annual basis because these plans change. Unlike a med sup that runs until you decide to either quit paying or the plan goes out, every Medicare Advantage product is a January 1 to December 31st contract. That's why they change a little bit. And that's why we have to recertify and come to know these products, because over the course of time, as inflation attacks the medical world, as the government throws more money at it, these insurance companies are obviously lobbying, trying to get more business. And so they make these products more rich. We get dental, vision, and hearing. We can get all kinds of add-on products. We can talk about that a little bit later, but you must get certified every year. What to expect with the certifications and what's being asked, we can go over some of that. It's different with different carriers. In some cases, we have a major carrier that you simply watch videos and then click as you've watched them. Others are pretty extensive testing. It's not as bad as the AHIP, but it's pretty extensive, really. They want you to know all about it. Now, the certification process does vary by carrier. So we can work hand in hand. We know them all. And so it's just part of the learning process.
Got to do it. No way around it.
No way around it. Okay. Okay. How to choose carriers.
Yeah.
You and I have gone through this a little bit. We have a tool available to us that we have a dashboard from CMS. And basically what we have access to, and we're going to show you an example of here in just a little bit, is we get a dashboard that tells us that specifically in every county in the country, what products are being sold.
Okay.
And so if you're in Tazewell County in Illinois, we can pull Tazewell County up and we can show you exactly all the products that have been sold in 2021. So we're going to look at the players who are dominating the marketplace in your county. We're going to want to become part of that troop because that's what's selling.
Right.
Selling for a reason.
Makes sense.
If they sell the majority of the products in that county, you have to come to understand that they've solved a lot of the problems associated with Medicare Advantage. So we like it. We can quickly access what plans are sold in your county. You can give me a call anytime. We're going to take a look at the reason I said Tazewell is because I baited this a little bit. We're going to take a look at Tazewell County and what we get to take a look at.
Okay.
So this is what it looks like when we go to this dashboard. This is every Medicare Advantage product that sold for January 1st for 2021. We don't have 2022s just yet.
Okay.
So I pulled this one. And so basically you can see the Humana's. I think Humana's got 4 or 5 different plans. You're also going to come to understand that you'll see like the second one is a Sierra Health and Insurance Company. That is Aetna's direct to consumer.
Oh,
we can't sell
do
that. We can't sell that.
Okay.
If a consumer from Tazewell County
are these listed in like Any certain order?
Yes, we went by volume on the right-hand
Okay,
side.
so
You
the-
can see, yeah,
That top one is the number one
exactly
player.
correct.
Huh. And that
And-
directed, that's the consumer's number two.
Exactly.
Huh.
And so now you can begin to see a little bit of the method behind our madness when it comes to what companies and what plans that we want to become effective with. Because basically, again, they figured it out. We'll get in and boil down all the add-on benefits. We'll boil down the out-of-pocket maximums. We'll boil down the
But
copays.
this pretty much tells you the story right there.
Tells
doesn't
us
it?
the story. Tells us the story. So it's not a mystery when I get a phone call from some county in Arizona that we can pull, Maricopa County in Arizona, we can pull up everything that's sold in Maricopa County in Arizona to give some qualified advice. That's
Yeah.
what we're trying to do.
That's a
So
good tool.
great tool. Great.
And do they have this tool or
No.
just us?
They would have access to it.
Uh-huh.
It's a little bit of a grind
Okay.
to put this together, to get it to come this direction.
All
So
right.
I'm not saying they can't do it,
Okay.
but just give us a call. It's
Yeah.
much easier,
That's
much
That's
easier,
what I do.
much
All right.
easier to give us a call.
Okay.
John, as you well know, networks have always been a little bit of an issue with Medicare Advantage.
Sure.
Yeah, a lot of regional carriers, there was a problem going outside the network between being in network, out of network. A lot of the major carriers have got that solved. And the Aetnas, the United Healthcares, the Cignas, the Humanas, they've got nationwide networks now, and it's becoming less and less of an issue.
Okay.
But this was a little bit about what has happened in the past. National players, again, you can read this, but like Aetna, Humana, United Healthcare, networks just aren't that much of a concern right now. It will be cyclical in nature because as the negotiations between insurance companies and doctors' organizations, we see it happen. We had on the, over in Springfield, we had Springfield Clinic and Blue Cross get into a little bit of a tip here recently. And it's what happens like this. But right now, the nature across the nation is that the network issue is less of a problem right now. So we like PPOs instead of HMOs. Now, that's kind of a baited statement, but the reason we like PPOs is they offer the most freedom. We're not restricted to what doctor inside the network we can go to. With HMOs, if I'm in an urban area, Chicago, St. Louis, and Indianapolis, New York, and I've got clients that never leave that.
Makes sense then. It's a different ballgame.
It's a different ballgame because those HMOs can put more on the add-on benefits because again, they're working
They're more
with a
restricted
network.
Yeah.
They're, and so they can throw more beans at the add-on benefits. And so that can look more attractive. So with that statement, we work a lot, not in the urban area. We work with a lot of rural brokers and brokers in smaller communities like Decatur, Springfield.
Right.
And we still have to consider the PPO product over the HMO.
Yeah.
I think that makes a lot of sense.
Sure does.
According to Milliman, which is a large underwriter for Medicare, $0 PPO plan growth is outpacing nationwide MAPD growth every year. So we can see that we're going to have more and more PPO products to take a look at. And those are all good. Those are all good. You can see a little bit of a chart. We don't need to go through it, but it corroborates a little bit about what the Milliman white paper has found.
Okay.
People sometimes buy for the extras, and I will tell you that when I talk to the consumers like the dental, vision, hearing benefits to it.
Yeah.
The transportation piece to this.
Yeah. Well, they see immediate usage, like if they're going to the dentist, they can use it if they're a healthy person. They don't go to the hospital so they feel like they're getting some benefit out of it. But
we've got Aetna plans in Illinois for 2022 in the northern side of this that's got $2,000 annual dental benefits attached to this with $0 deductible. I mean, first dollar they go in, they can spend $2,000, submit the bills and get paid.
Yeah.
And so you're right. That person that doesn't go to the doctor often has some dental issues or just coming off of it becomes very important. And so not that people buy for the extras and we cannot sell to the extras. One of the things you're going to learn in the compliance side of the equation is we cannot sell to that, but we have to become very familiar with what they are and how they work. We've got a lot of assistance from all the carriers on telephone numbers and websites that we can go to find out exactly how it works. It's important to understand what motivates seniors. Here's going to be sorry about this. We're going to get out of that. It's important to understand what motivates seniors. And seniors often buy a plan based on the extra benefits. I mean, there's just no getting around it. We need to know about it. If we drop down to that last bullet point, next Thursday, John, you and I are going to host on Thursday, I think at 2:00 in the afternoon, the 10th, our partners in the integrity world, Deft Research is basically, I forgot how many thousands of Medicare seniors that they interviewed.
Yeah, and guys, that's for you that are on this, you want to make sure, and if you can, listen in on that one. I think that one will really be interesting. That Deft Research is, like Steve said, it's an integrity partner now, but they're the go-to for all of these carriers when they're designing product.
Yep.
I mean, whether you're associated with integrity or not, Deft was the household name, kind of like CSG for quoting. They were the ones for research and data to say, hey, this product is working in this area and here's why, or we need to develop a product. And I mean, almost every carrier, I think, lined up with them.
One of the founders, Tim Broussard, is going to be on with
Yeah,
us.
it'll be really interesting. You don't want to miss out.
Yeah, and so again, what motivates our seniors to buy the plans? And this is all in an effort to make your experience as streamlined as possible. Again, I'm going to throw a plug. You know, if you've not signed up with any of these carriers, if you do have some MA carriers out there that you're part of this, we would love to have your business, because this is how we spend our investment dollars, is trying to make your experience better. So if we could flip the page, Jason, roll. And when we say narrow it down, it's just that we don't want to make it complicated. We think if you've got a Humana and an Aetna product that's hot, if you got 3 or 4 plans of each, we're going to recommend an Aetna and Humana.
Yeah.
Whatever's playing in your world.
Sure.
Is how
it just makes sense.
Yeah.
You just can't do them all and be an expert in all of them. And it just pick the hot ones and run.
Once we get you through the AHIP, 90% of what we do is going to be done. But basically, that's going to be the major part, because we will have a reasonable conversation. We'll have a reasonable selection of what we would advise you to get, and go through the certification process. You'll become experts in each one of those plans. They look a lot alike. There's not like there's a whole bunch of different MA plans. There is the medical savings account that's out there. We'll probably talk about that in the right situation. But there's the PPO plans that you're going to find a copay at the doctor's office. You're going to find a copay at the lab.
Making sure all your doctors are in the network.
Exactly.
They're all the ones you like to use are in there.
All these carriers provide tools for us to go to make sure that happens.
Right.
So that's what we talk about when we say we're going to narrow it down. Our recommendation: choose 3 or 4 carriers to certify with each. Reference the CMS enrollment data that we showed you just a little bit ago. Connect with us if you ever want to confirm which carriers to focus on. I get calls all the time and from people that say, "Oh, I didn't know that Humana had that," or "I didn't know that Aetna had this product,"
right?
Or "I didn't know that add-on benefit was available." So we surprise people every day when we get that phone call. So yeah. And at this point, we'll open it up for questions.
Wow.
So
Great.
we flew right through that. So a little bit ahead of the 9 o'clock. So I'm not certain who we've got on there, but if there's any questions, Jason?
No questions so far.
Covered it
We're
all,
fine.
man.
We're fine then.
Guys, if you need us, you know where to find us. Just call here. And,
We'll be reaching back. I often like to reach back to the people
Yeah.
that we don't know.
Yeah.
We want you to come to know who we are.
Thanks for tuning in.
Thanks for tuning in.
Have a great day, fellas and ladies.